Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 or 60 minutes in total, maybe less, speaking about one of the programs that we're a huge advocate for, particularly for our North Texas market, where they are one of the premier providers of care to the Medicare population, and that is our friends over at Care. We have a guest speaker with us here today, Mr. Steve Plocek, and he will be taking the reins here very shortly. I did want to, however, set a little bit of, we'll put a little housekeeping out of the way in the fact that today's presentation is being recorded, will be available on our website at premiersmi.com and on our YouTube channel, and will be available through all the agent success managers that you deal with on a day-to-day basis with Premier. You'll note that in the software there is a section for both questions and chat. Put your questions in the questions box. We'll make certain that we have them covered for you so you maximize the return of investment on the time that you spend with us. But we want to make certain that we accommodate you in whatever fashion we can. I also want you to know that today's presentation is being developed for agents of different experience levels. And so some folks might think some of this is remedial, some might think it's a great review. Some folks, it may be brand new to them, but we wanted you to be aware of that. And so we'll do a brief level set as to who Premier is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states, act as insurance wholesalers through independent insurance agents such as yourself. And we do so through contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. We do so through a full portfolio of products that's aimed at our target audience, the Medicare population, and we do so with the mindset that we have to apply different compliance regulations and make certain that we are taking advantage of the guidelines that the government gives us when it comes to enrollment and disenrollment of individuals. So not only the standard election periods, but the special election periods and the special election periods, which gives us an opportunity to make 2023 the best year ever, and we hope to do so through our partnership with Mr. Plocek and Care. So at this point in time, I'm going to turn the helm over to Steve and ask him to give us a little bit of insight on certain portions of the Care programs and what we can do. And Steve, hopefully you should have control there. Yep.
Should be coming up. Can you see my full screen?
Yes, sir.
This, I'm actually gonna move this over and I want to pop it like that. How's that look, John?
Perfect. That's what we're after, Steve. Thank you.
Good deal. Thank you. Well, John, as always, I am very pleased and appreciative to have an opportunity to be one of your guests, Premier. This is a relationship that means a lot to me, and I very much appreciate what your agents basically do for Care. Today's presentation is really, it's a little bit different in the aspect of what we do for members. And as an agent, and I'm going to beat John to it before he beats me to it, but we use a saying from an old leader that we had when we were repping. When we were agents. And one of the things that you basically come across when you're agents basically is taking care of your book of business, taking care of your members, right? And Care has been working and getting better in the areas of that self-service aspect of basically, more and more, especially the seniors that we see aging in here the last 3 to 4 or 5 years, basically, those individuals are a lot more self-service than maybe agent, members or Medicare eligibles were maybe in the early 2000s, right? 20 years ago, right? So all in all, I'm going to go through basically showing, how basically members can access and everything that you see on the screen, from find a provider to, just a regular PCP or a specialist, or find a Silver Sneakers location, or what their ID card really means to them. And a lot of times that's helpful also to the agents to really understand it. But at the end of the day, what I'm really trying to accomplish, especially from the agent's point of view, is to understand what tools are out there that they can leverage with their members in a self-service scenario. Now, there's still sometimes you got to call customer service, but there's many of these things they can look up, find out themselves and handle themselves. And in many situations, that's what they would rather do. So give them that information that they need to make their decisions and take care of whatever their needs are. I mean, we all have, clients or members that, maybe a little bit more needy in some scenarios, but we're seeing more and more individuals that want that self-service opportunity to take care of themselves, period. So that's really what this presentation is about. Like John said, this is, really aimed at a lot of our members, but I wanted you to understand that Care is not only in there just to get you guys to go sign up, but we're not just interested in signing up members, but we're also out there in the community. I think we're wrapping up early next week. We'll be wrapping up our 4th member meeting. So we're out there doing those member meetings, engaging with your clients in that scenario, helping them stay on that plan, putting Velcro on those folks, that double-sided tape to stick them on. So you can go and focus on what? Growing your business, growing that business out there. So all in all, I want to go through this presentation again. As John said, I think he said that more for my benefit, that some of this could be viewed, especially by a seasoned agent, as a bit remedial. So I will be moving through this fairly quick. As John said, this is going to be recorded, and I certainly do appreciate everything that Premier and Mr. Dubas does for all of us. You'll be able to see this PowerPoint basically at a later time. If you wanted to, or access it or view it at a later. It is. You can see down here in the bottom of it, this is an approved CMS document. So let me get going here. If I can. There we go. I think. There we go. So let's start out with find a provider. So again, talked about that remedial aspect. You go to a cnchealthplan.com. cnchealthplan.com is how you're going to find Care. As I'm going through this presentation with our members, really this is the area at that top basically that we really understand that member aspect, right? So you're understanding, hey, this is where you go. So an individual basically would click on that member, come down here, find a provider. I did this earlier, but when we still had 2 plans available back in AEP, so you can look at it 2022 or 2023. If you go to the website today, it's just going to show that 2023. Individual click on that 2023 provider lookup, choose the plan that was applicable to them, what plan that they were actually on. So Care basically in this situation where we're looking at providers, we look at basically 2 different HMO products out there. You have the Southwestern Health Select that's only offered in 5 of the 13 counties that we do business in. We have that classic HMO that's offered in all 13 counties, or PPO. So an individual would select that plan. So let's just say, for instance, individuals on that Southwestern Health Select HMO, obviously residing in one of those 5 counties, click on that. It's going to sit there and you can look up a doctor, if you knew that, you wanted to go see Dr. Brown because Dr. Brown had been your cardiologist all that time, or you were just looking for a primary care doctor, period, a 10-mile radius. I've used an example. If we look there at the bottom of the page of 76054, those of you that are familiar, that's in Hurst, Texas, in the mid-city kind of area of the Dallas-Fort Worth Metroplex. Boom, pops it up. You got 219 doctors showing basically in that area. Shows basically if they're on the plan, what the situation is, maps, information, phone numbers, a little bit about that office. They can blow that up and they can learn as much as they want about that doctor's office. So again, fairly easy to look that up, find it. I think it's very easy. This has definitely been updated in the last basically 4 or 5 months. It's a lot more user-friendly, what I call GUI. It's prettier. There's more hyperlinks and information in there to be as helpful to that end user as possible. So let's say we're, second most important thing, I don't know, depends who you're talking to and what day, it's either providers or it's medications, it's pharmaceuticals, it's drugs, right? So once again, hey, access your drug benefit, understand maybe a formulary, understand a co-payment. Hey, doctor gave you a new drug, you understand, you've been taking generics. Now you want to understand exactly what that is. You want to use an online tool. Care is here to support it. Go to that members once again. Click on, like we see down there, find that pharmacy information. Again, it would say 2023 basically in the updated. I do apologize for that, not having that slide updated. So we go in there and we could sit there and look at basically what plan that we're on once again. All right, all of this, what drugs are covered, look up just straight up buying medication, find that pharmacy. By on that note, just want to let everybody know, what is Care's preferred pharmacies? All of them are. We don't have a preferred. So there isn't anybody out there that we don't work with, especially when we come with our big national names. We talk about a Sam's or a Costco, a CVS, a Kroger, a Walmart, Walgreens, on and on and on. I'm not saying that we work with every single pharmacist out there, but we work with a lot of independent pharmacists out there. When we get into more of our rural areas, maybe south, west side of the Metroplex, Palo Pinto, that's 2 counties out from Fort Worth to the west, or maybe we go down south, Stevensville and Erath County, or Granbury down in Hood. You can see some more mom and pop, maybe not the big box names that we're used to seeing, maybe smack dab in the middle of Dallas, right? But all in all, there's all that great information that an individual has that access to. If they were on our most popular plan, they could go in there and look at that PPO choice, or not our choice plan. This, what I'm showing on the plan or on the screen, is our choice premium plan, showing those co-payments for 30 days, 90 days, whether it's through the mail or you'll see it in a retail situation. One thing I did want to point out, kind of on an agent side, you don't see a whole lot of differentiation. So if an individual wanted to go in a 30-day scenario to retail, or let's flip over 90 days, they wanted a 3-month supply, buy 2 months, get 1 free. You look at those prices, same. A lot of times you're not going to get a discount unless you go through the mail. Some people are interested in that, some people aren't. Some people just like the flexibility. How about that? That's what I like. I like flexibility. Again, look at that Choice Plus, shows these different plans out there. There's that most popular plan. There's that straight up PPO choice plan. So again, all that information's there. Talks about basically, I'm really trying to push them in this scenario, really works on, our medical aspect of keeping these people as healthy as possible, but really kind of explaining and showing them how much money you're saving, right? Go through those. Then I go over the donut hole, right? The drug coverage stages with individuals. And one of the things that I want to highlight that's unique, maybe not the only plan, and there's certainly plans out there that don't have a deductible that are full MAPD plans, but Care most certainly does not have anything really relative in stage 1, other than the fact that, hey, on Care, there's no deductible. So there's no deductible to meet before we start going towards that 4660, right? When we start running into that donut hole. Talk about that initial stage, coverage stage of, our stage 2. We talk about getting in that donut hole, being responsible for that 25%, and then obviously that catastrophic coverage. I also like to talk to these members out there and explain to them, we don't see any kind of, we have gap coverage. They're not going to run in and have any kind of responsibility for a tier 1 if they did even hit the gap. One of the things, again, unique selling point of why be on Care as a member, or why as an agent represent that Care plan. I have not found a plan. That's my statement. Don't see one out there, and I've looked in a national role, not being a chronic plan, that covers COPD inhalers, up to 11 of those medications through the gap, paying $70 for a 3-month supply in that scenario, following suit with what CMS came out and really mandated for all of them with that insulin saver program, right? But doing that with those puffers, because guys, we all know, and we've heard some of those stories, and if you haven't, you will soon if you stay in this industry that long. What happens if your puffer is out? What happens if all of a sudden now you got to spend even 25% of $600 for a 30-day supply, or a 30-day dose basically of a puffer? Maybe not a good scenario. Maybe we have ambulances, maybe we have emergency rooms, maybe we have hospitals, and maybe that's just the good side of it, right? I mean, that's really important. I think that's something that you need to consider when you're out there representing, you're talking to your clients, you're talking within the community, you're talking about plans out there, and understand basically what Care stands for in that scenario. What they stand for is doing the best they can to take care of individuals, and understanding where we see really high utilization around individuals or admittance into hospitals for very, very simple stuff that could be handled well before. And also do what? basically uplift that individual's life. Who wants to go get an ambulance? Who wants to go to an emergency room or a hospital? Hey, well, why don't we take care of it in a preventative manner before it gets to that? We also talk about some of the new mandates around vaccines, basically, and insulin in this scenario when I'm touching on this whole Part D with them. These are basically a list of those insulins that are part of that saver. We go over that, make sure they are on it. People stand up, especially on this next slide, when it comes to those COPD drugs, those inhalers, and they stand up. That's why I'm here. Not here at the meeting, but that's why I'm on your plan. All right. So, I mean, those are just things that I'm hearing out there. I'm not trying to sell anybody. These are people that are already members. These are possibly your clients out there. That are in this scenario. I'm not trying to flip them. I'm not trying to move them. I'm trying to educate them on the plan they're on and make sure they understand why that they're on this plan and what this plan is doing to take care of those individuals. More of these medications. These are some of your insulins. Then we talk about that OTC. We understand that our vendor is Medline. Medline is based basically on the south side of Dallas in Lancaster, Texas. That's, boom, in Dallas County, right? So understand in that situation, I've had individuals talk about, well, I've gotten same day delivery and there's no charge for it. Well, of course, there's not going to be any charge for it. I think they might have gotten maybe mistaken with Amazon or some other kind of product or some other kind of program that it was same day. I'm not seeing same day, but most regularly, in many, many cases, I'm seeing 1 to 2 days from when the order is placed in that scenario. And our members most certainly are in that situation, but telling them to take advantage of this. Care on the majority of their plans has $60. This is how they would go in there and find that information. Once again, they would go to that member. They would slide on down here to tools and resources. Go in there and click on that OTC. And then be able to call, basically, either go online directly to Medline's website, do that ordering, and go through it. You see catalogs are based there. They obviously would only have the 2023 basically available to them. But in that scenario, they look at that. It's use it or lose it. It's $60 on all of our plans except for our MA only plan or MA only PPO choice plan. That plan is $40, but it's $40, lose it or use it or lose it at the quarter. All right. So there's $60 there, those individuals. Hey, we talk about how much a dozen eggs cost and, 60% basically increase year over year. And folks are bringing them across the border and all this kind of stuff, right? So if there's a way that we can help our seniors basically take care of themselves, I think it's awesome. And one of the things that I'd done one of these meetings, came back a month later, happened to be at a YMCA, ran into it again, or did the meeting again and ran into basically one of the individuals that attended, one of the members, care members that attended the meeting, previously, the month before. And she came over to me and she kind of got real close to me and she kind of was whispering. She goes, you were talking about that catalog and, you need to go tell all the rest of the care people that, I looked under, I pulled my cabinet door open and I was looking underneath. And I found some Pepto-Bismol from 1995. People need to look at their expiration date. I thought that was sweet. I thought it was funny. But you know what? It's real. All right. Somebody might have something down there. I'd hate to think of what basically Pepto-Bismol looked like basically from 1996 in that bottle. But, I don't have a visual for you in that. And I think that's thank goodness for you and me too. But all in all, hey, it's a great thing that when we're out there, we talk to basically our members when they look at these. I don't need that. I don't need that. But hey, go check. You kind of have that staple goods of spices when you do your cooking. Well, you kind of have your staple goods of how you take care of yourself. Underneath, basically, a lot of folks have it in that sink or maybe that medicine cabinet, right? Of those just basic things that you just kind of have that are OTC. And when you're like, well, I don't need any of that, I don't need it. Well, hey, have you gone to look at your expiration date? That's my point. I thought it was great. Understand how much we learn from our members. As much as I learn from agents, I learn from members. You learn from your clients out there on basically how to take advantage. Use these benefits to the best of your ability out there. Take advantage of it. I don't think anybody's ripping anybody off here, right? You're taking advantage of it. You have this benefit. Use it, right? But I didn't mean to be getting us off track, but I really wanted to explain that to them. Dental's always a huge, basically, interest of a lot of our Medicare eligibles out there. Once again, where are we going to go? We're going to click on that, members. you know, in this scenario. And of course, you know, any of us can use this too in a scenario just to understand our plan, understand basically what the benefits are, right? So you click on that members, you come in here, you'd say find that provider. They're going to tell you, hey, go check this out. What kind of provider do you want to look at? You know, we already went through just finding that medical. We talked about that pharmacy, but right now we're talking about dentists. So we're going to go in there and click in on that dentist. It's going to say, hey, man, make sure you understand you're getting ready to, you know, go find a dental provider. You're going to be leaving basically this plan or this website. It's going to take you over to DentaQuest. DentaQuest, you're going to go in there. You're going to choose that location. You're going to choose that plan in that scenario. Pick your zip code, make sure that this is correct. Again, I was using a different Hearst zip code, not 54, but 53, but once again, in the center of the Metroplex. Go in there and choose that plan. You're on that Care and Care, Medicare, that Care and Care plan. Boom, there you are. You're starting to look at what kind of dentist. You're looking up by name, you're looking up by specialty. How do you want to find this? Search them all. Boom. What do? Throw in that 53, that Hearst zip code. We're sitting there looking at individuals that are in the network, that are part of that network, that a 25-mile radius of Hearst, Texas, pretty broad, but still substantial amount of physicians or dentists basically in that area of over 1,500 dentists that basically accept this plan. These people would have to be able to access. And while I'm talking about it, there's two types of dental that Care and Care has. As their embedded dental, that's our preventative, that's our x-rays, our cleaning, our fluoride, our exam, right? And that's covered at no charge, basically in or out of network. And then we have a dental rider. It's $25 basically rider, so $25 monthly premium. An individual as of 2023 can sign up any month they want to sign up. According to Medicare regulations, they can cancel anytime they want. First the following month, of course, right? Sign up basically first the following month. Basically discontinue or cancel that plan first the following month. Now, if you cancel within that year, you can't come back until AEP goes in effect January 1st. So can't let people go and flipping and flopping, but if somebody just wants to hop on and they haven't been on the plan within that basically calendar year, boom, they can hop on. They want to cancel that plan basically 2 months, 3 months, 6 months, 1 month down the road, boom, they can cancel first the following month. They're good. But when we talk about that dental rider, talk about $7,500, $7,500 a year. Whoa, that sounds pretty hot. Well, what's the catch? I'm here to tell you what the catch is. It's up to 50% if you're in network, 50% of whatever that dentist or whatever that procedure is you know, keyed in at. Say it's a crown, $1,200 crown, your member would be responsible for $600. DentaQuest, and Care and Care, they're going to be responsible for that other $600. So it's up to 50% of that procedure, of that code, right? Now that's basically in network. If an individual decided that they wanted to go get services out of network, DentaQuest has that $1,200. Let's just say that's what it is for the crown, for example. But that dentist out of network, he wants to charge $2,000. Well, in that scenario, DentaQuest, basically Care and Care, they're going to pay $600. Your client, your member, would be responsible in that scenario for $1,400. Okay, because they're going to pay that max, that up to 50, what they would in. The individual decides to go out, they're going to pay whatever that is plus the difference in that scenario. So I hope I made that clear. I hope I didn't basically confuse anybody in that scenario. But if there is a question, somebody wants to basically reach out to us basically after they see this in a recording situation, please don't hesitate to reach out. We'll do our best to basically make sure you understand that. But that's the information regarding that dentist. iMed is our vendor that we use as far as our glasses go out there. Once again, we're getting in that same pattern. Click in there for the members, right? Click in there to find a provider. What am I looking for? Checking out that vision, right? Gonna take you basically sit there and say, throw a zip code. Once again, I threw in her zip code. Sits there and shows you, hey, got 60 docs right there, man, in that area, right? Basically, you're working with, and you see, yeah, Target's part of that program. Heard a couple members that I have talked to in the last couple meetings, probably this is back in January, We do not work with Costco at this time, and that's something that we are working with IMED to see if there's any ability for us to be able to add them to our network. Heard that more than once, that people are looking Costco. To be honest with you, it's my family, it's myself, whatever kind of insurance I'm dealing with, that's where I'm going to end up also. So I wasn't really surprised to hear that at all. So we were working to get that, see if we can get them added to the program. I have not heard back as of yet, but once again, this is how an individual go out there and try to take advantage of their vision benefit. True Hearing. We're going to go through the same program here, guys, for all intents and purposes. True Hearing is our vendor that we use as far as our hearing aids go. They're going to click on members. They're going to find that provider. They're going to go in there and they're going to look for hearing. Hearing's a teeny bit different, that we just don't go show you a big map and a big list of everybody we go to. What we're going to do at the end of the day, we're going to ask you to sit there and we're going to call our value-added hotline that is answered by our customer service team, and they are going to transfer and work with you to set up an appointment with basically an audiologist, basically that is representing True Hearing as close to basically your home as possible, so you're not driving all over the Metroplex. Okay, Silver Sneakers. Get real excited about Silver Sneakers. I think this is a great program. Basically, I was in this market doing business, as I mentioned before, when John and I were repping, when Silver Sneakers wasn't in the market. We never had a benefit, a fitness program out there at all. And I kind of wondered what it was about. And I'm always kind of that doubting Thomas kind of, what the heck is this whole thing about? And one of the ways that I really learn in as many situations that I can, I like to be hands-on. I'm a sales guy, right? So I took advantage of it one time and I went and sat in one of the classes. The classes is a whole lot more than a chair-based program that has expanded over the years into the pool, as far as water aerobics, into all kind of different forms of exercising, right? A lot more higher impact things or different kind of programs they have out there. But the biggest thing that I saw in that experience of going and attending a class, sitting in the back, just being basically a member of the plan, going through the motion. Yes, I looked pretty odd there, maybe not as much as some of you guys out there, and there were definitely many seniors in there with more hair than me. But all in all, the point is that muscle between their ears, that's what I saw the true exercise of. The social aspect of it. How many of your clients that you work with are widowers? They're by themselves. They lived X 10 years, 20, 50, whatever years with a spouse. And now they're all by themselves. Yeah, the physical activity, talk to any physician, is very, very important to the well-being of an individual and their vitality of life and living a long, basically mobile life as possible, right? Of course it is. But I'm telling you, that social aspect, that mental aspect, that community aspect, that relationship with those folks in those classes is huge. Every once in a while, I'd follow up at a different gym. Basically, maybe I was out in the field selling, got done early, with whatever kind of appointment, would stop by a gym, and you notice, man, they're doing a potluck. They're all getting on a bus. They're going gambling, right? They're doing a costume party. So it's much more than just some people working with some hand weights, some rubber bands, standing up behind a chair, working on some range of motion. I think Silver Sneakers is a great program, and I think anything you can do as a proponent to push people in that program, you need to be doing that. I mean, you need to be doing that for all the reasons I just mentioned, and then also understand that all the carriers, beyond Care and Care, name whatever one you want. There isn't anybody out there that doesn't have some type of benefit around this, right? They're paying good money for this. Those benefits are diluted so that the plans basically can offer this. The plans can offer this at a no charge. We need your help as agents basically to promote it. I don't mean to speak for my competitors out there, but I would be very surprised if they would have any different tune to the song than what I just sang. Let's keep moving here. We're getting close to wrapping this guy up. But this is basically, individual goes to that tools at silversneakers.com, activate their account, boom, they're setting it up, they're good to go. Go and fill this out, relatively simple, and they're good to go and they're online. Let's talk a little bit about their card. I think this is great information. What we're looking at is two different cards here. If we look over on the left-hand side, we see a classic HMO, See that classic or that choice PPO over on the right-hand side. Kind of explain that information. Hey, you're going to get this card. This is what it's going to look like. Has basically the H code basically on these plans. If we look in that lower area of the card, that lower left-hand area, you flip those cards over to the back. One of the things that I really kind of pushed basically for this next year, talks about copays, getting a little ahead of myself here. You flip it over to the back, we kind of threw those logos in there, basically is showing who those different folks were, and in some of the scenarios, added phone numbers straight up that weren't there in the past, right? Seeing basically those different vendors, making them aware of that's who they're getting that service through. That's how they get that benefit. True here in DentaQuest. ND Live, we really didn't talk about that a whole lot, but that's basically that telehealth basically benefit that these Care members have out there, right? Kind of click through this, you guys can see really what's on that card. Again, a little more remedial for some of our members out there. A lot of good information for them right there in their pocket. And then we have really kind of wrapping up here. You know, I'm really trying to show these folks, this is the only time we're really not going to go directly to that member, basically, hyperlink at the top of the page. We're going to go to events. You know, what's Care doing in the community, basically, as far as, you know, social aspects or education or things like that. Individual could come in there and click on you know, the events in this scenario, click on those different kind of community events, and we look at in this scenario, you know, hey, they have trivia over here in Richardson, kicking in Cannondale, basically, south side of Fort Worth, basically, you know, different types of events to basically engage, you know, different, you know, the members within the community. But going to be wrapping up basically that presentation here. Again, just keeping you apprised of what we're doing for our members, your clients out there, because your clients basically, I think, are most certainly our business in that scenario, especially your Care clients, and making them stick on a plan. It's your responsibility too, because if you're not touching them, possibly somebody else is. Not saying they're doing anything shady or unethical, but at the end of the day, we want to support our agents out there in doing everything we can to take care of questions, concerns, issues, engagement, basically, with these Care folks, so you can do really what you're out there to do, which is grow your business. Get out there and educate individuals on the different Medicare Advantage plans, on the different Medicare supplements, PDPs, what have you, on the different plans out there and the different options these individuals have. But at this time, I'm ready to kind of wrap up my side of the presentation. John, I'm going to bounce that ball back to you, or ask you to take that ball from me. And I just really do appreciate everybody's opportunity and their attention this afternoon.
Awesome. I thank you, Steve. I think what you've demonstrated, as always in your presentations, is the viewpoint from a human side of how plans work and how we look at things as an agent, and how we look at things as a member. And I really appreciate that perspective that you bring to the table in each and every one of your presentations. And thank you for that. We're gonna finish up really quickly with some different things that many agents have already seen from us here at Premier, and that is why you want to work with Premier and Care. And it's because we do things to make things as simple as possible, making the contracting process electronic so it goes through smoothly and more quickly, providing discounted E&O for agents to make certain that they're covered for financial responsibility regardless of whom they contract through, making certain that we can support your efforts in keeping your license in play through bundling and discounting continuing education courses through our affiliation with WebCE, and give you an opportunity to add to your own benefit structure through a modified guarantee issue DI policy, disability income program, that you can take out on yourself that you're paid a commission on. Much as where today's presentation is being recorded, past presentations have been as well. And so what we have here is an opportunity to take what we've learned with Care, that's the information that Steve has given to us, and take it into the community and differentiate ourselves from every other program that's out there. And there's a ton of them out there. What makes the difference? In my mind, it goes beyond the $1 on a copay here or whatever it happens to be. It's the heart behind it. And where your treasure lies, there your heart shall be, if you want to go biblical on it. And I think that's one of the things that we see demonstrated in today's presentation. We also give you access to a great tool in Medicare Center. This, I could spend a half an hour on this alone. So we're going to make certain that that's delivered in a separate presentation, and make certain that you realize that there are also other compensation programs available for you through different programs that allow that. When we look in the Medicare Advantage space, can't do that. Max comp is set by the government. There are other programs, however, that you can use those incentives to perhaps qualify for additional trips, or even the return of our producers convention, which is back from the hiatus imposed upon it by the pandemic. We do have different lead programs to put you in place in front of folks, so you can speak to the differentiating factors of the different plans that are out there and illustrate what Steve has talked about today through direct mail, through vetted lead vendors to make certain we stay compliant and maximize the return on that investment, different mail programs that you can purchase to fill your calendar, different internet programs to reach out to people as well. And we want to make certain that you are aware of the lead program within Medicare Center that you control, that you can turn on and off. It's in the CRM. It makes life easy for you, because it's not just who raises their hand, it's what you can do with them. You know, can you close them? Can you make them a part of your book of business? Can you become part of their life and they become part of yours, in a manner of speaking? And having a good lead flow is the starting point for that, as is finding where some of these folks live for different programs. We have a complimentary T65 locator that's a bit of an analogy in the anomaly in the title, because you can use it for a number of different purposes, but that is something that's available to you as well. We also want to make certain that when you offer a stellar program like Care & Care, you don't forget to do a very important thing, and that's ask for referrals. And sometimes this works so well, we forget to do it. It's like a lot of things, you know, in life that, oh my, if that works, there's got to be an easier way to do it. Not so, said the wise man. This gives you an opportunity to work through the selling process, the prospecting process. These are some of the things that Steve and I used to tease each other about when we sat across the hall from each other, repping, as we say in our own little vernacular. But this is a program that you can take one lead, make it grow, and engage your book of business to do the same thing. When you have a stellar program that has a high satisfaction rating to it, it's easy to go back to those folks and say, who else do you know? Can you get them to call me? We do this because we want your business. We want to put it with a carrier that cares and makes a difference. No pun. We want to care, really, and move forward with it. So let's make this part of our marketing plan. Let's put it in play, and we go forward and prosper. For those of you that have done business with us and are watching this webinar, I thank you for the business. We look forward to the opportunity to enrich that relationship. For those of you that are checking us out, thank you for that opportunity. We look to earn your business as well, and we look to put you in play with Care & Care, because, man, there's business to be written here in North Texas, and we look at some of the changes that are being brought about with Medicaid assistance and some of the things that might come about in May. We need to talk about that, because all of a sudden Care & Care is a very viable option for those folks. But most of all, at this point in time, I want to thank you for the investment of your most precious resource, and that's your time. You spent it with us here today, and I thank you for doing so. So until we are able to visit with you again, I wish you good selling. Thanks so much. We'll talk to you soon. And thank you, Steve.
Take care, big guy. Bye now.